I'd like to have General Counsel read us out of closed session.
Yes, thank you, Madam Chair. The board considered 7 items in closed session this evening, and I would refer the public to the agenda. Items 5.1 through 5.5, there was no reportable action. For item 5.6, approval of closed session minutes, those were approved on a 5-0 vote. And regarding medical staff credentialing, the 7th item, those recommended credentialing decisions, those were also approved on a 5-0 vote. That's it.
Okay, thank you so much. Are there any deletions or corrections to the posted agenda? Okay. Hearing and seeing none, then I'll ask for audience input, and this is an opportunity for anybody in our audience to speak on something other than what is on our agenda. And if there's anyone that would like to speak, we do limit you to 3 minutes. And if you would please give your name before you begin to speak. We also accept any input from our audience in writing or by phone. And I'll ask our clerk if she has received any information for audience input.
I have not received anything written, but you do have a number of members of the public on this evening.
All right, thank you. So do I have anybody that would like to speak on something other than what's on the agenda?
Hi, my
And
name
just
is
so the public is
Bacon.
aware, there is a raise hand feature in Zoom that you can use, which is located at the bottom of your screen, likely under the reactions tab, and you can click on that if you would like to be in the queue as well.
Well, thank you again, David, for pointing that out. A couple of things that I did want to remind you also is that the public is able to speak for their limited time, but we are not allowed to discuss it according to the Brown Act. If the board feels that it's something that we would like to discuss, then we can have it agendized at a later meeting. So again, I'll open it up for audience input.
Chair Wong, Stephanie Bacon has her hand raised.
All right. I'm sorry, I don't have, oh, there she is. All right, Stephanie Bacon, you have the microphone.
Awesome, thank you. Can everybody hear me? And my goal was actually to get some questions answered, and your clarification about the Brown Act is saying that you can't answer the questions. So what I'll do is I'll go ahead and just ask the questions. I hope that at some point you'll find a way to get back to me. And just so it's easier, I can either email them to the clerk or I'll paste them into the chat feature of the Zoom meeting.
Thank you.
All right, and I appreciate the opportunity to speak. Again, I just wanna ask some questions. I was born and raised in Truckee, and both of my parents worked at Tahoe Forest Hospital. So I certainly have a long affection for the hospital and for the community. I'm going to refer to a letter that I wrote to all board members and to Mr. Weiss. I had an experience at Tahoe Forest Hospital that was really disappointing, both in terms of service and in terms of what it cost me and my family. I went to the ER 2 times for the same problem. The second time I told the ER doc exactly what had happened before, how it was resolved. Of course, it's all in my chart, so I didn't even have to say it. The first bill was $1,600. The second bill was $3,600. And for me, I'm a public school teacher. That's a significant amount of money. And as I've, our benefits have been reduced year after year as public school teachers. And so I have like a mediocre plan. So that came a lot out of my pocket. So one question I had is, the board is an elected body, but I didn't receive any board member response to my letter. And I just wondered, is that a practice? Does this board make an agreement? We don't respond to these emails. I've served on many boards. I've also interacted with other boards, and this is the first time I've gotten no response. So that's my first question. My second question is that Mr. Weiss and he took some time to get back to me. We had an email exchange wherein he kind of rounded it out, his response to me, that I should feel lucky because he went to the ER and was charged $3,800 and only had his vitals taken. So my question to all of you is that what we want to compare our care to? Is that the kind of care we say, yeah, well, it's better than that, so it was fine? Do you think that's a good example of a well-functioning healthcare system? Then my other question is, my case was reviewed by a couple different administrative offices at the hospital. And we all knew that the second visit was more expensive because of some blood tests that were administered. But I can't get anyone to talk to me about the blood tests. And I don't understand how, knowing how high costs are, that we can administer blood tests and deem that as the quality care people deemed it. They deemed that was appropriate. And it's like, it's not appropriate to test people. I didn't know why they were testing me. I asked not to be tested. I'm not one single physician, even after following up the multi-specialty clinics, will tell me what they're for. And then lastly,
Stephanie, if you could wrap it up, the last question, and then we'll.
This is my last question.
Yeah.
So my last question is that Mr. Weiss asked me to respectfully engage in how healthcare really works. And that was really interesting to me. So I'm just asking him, I did write a letter and say, please tell me what that means. Like, respectfully engage in how healthcare really works. Like, I feel like I'm trying, but he intimated that I'm not doing it right. And all I want him to do is clarify. I read, I vote, I write, I research, and I can't be clear if this is an engagement that's going to help.
Okay, Stephanie, we appreciate your comments. We did all receive your letter. We have read it. We understood that Mr. Weiss was going to be responding. You had sent that letter to him as well. And I think at that time, we felt that your questions would be answered. I think yours is a individual issue. And so I'd like to take that offline. And if you could leave your number with our clerk, we'll have someone that might be able to help you find out your information. As far as your blood work and that, I wondered if you have talked to your primary physician who might be able to explain that to you, because he would be the one who could put all the pieces together for you. So that would be our recommendation.
I did exactly what the ER doctor told me to do with follow-up. I still don't know what happened. And I did go to the multi-specialty clinic. But what is the best way to get my number to your clerk?
You could put it in the chat box and to Martina, and she'll get it to us. Thanks. So thank you again.
Thank you.
Any other audience input? Okay, seeing no more hands, we'll move on to input from our Employees Association. Is there anybody from the Employee Station available to speak? Hearing none or seeing no hands. We'll move on to our next item, and that's those of acknowledgement. And I'll begin with our first acknowledgement, Pastor Wayne Hogue. I'll share a letter that he sent. It says, I have been roaming the halls of Tahoe Forest Hospital since the summer of 1991, at which time I was called to the senior pastor of Sierra Bible Church. First, it was making pastoral visits to my parishioners. Next, it was joining Father Stanley Paltrick in founding a pastoral care ministry at the hospital. Shortly after that, when Father Stanley moved from Truckee, I became the director of pastoral care and have held that position for nearly 25 years. I am presently writing this letter to inform you that I will be stepping aside from both the pastoral care team as well as the directorship of the program. It has been an honor and a privilege to serve Tahoe Forest Hospital, both its patients and its staff, after all these years. The hospital has been my home away from home and has filled my heart with much joy. During this time, I have also served as a member of the Hospital Bioethics Committee, I will also be stepping aside from that responsibility. Thank you for entrusting me with this position. And even though the number of community pastors who are presently part of the pastoral care team is at an all-time low, probably much due to the COVID-19 restrictions, I do hope and pray that the program will find a new life and vitality and continue to serve our hospital. And I want to say that we are so grateful and to thank Pastor Hogue for those many years that he attended to the spiritual needs of our patients. We certainly wish him the best in all his future endeavors, and that we hope that he keeps the hospital district in his daily prayers. Thank you again, Pastor Hogue.
Thank you.
Yeah, a round of applause. I mean, 30 years as our pastor, what a wonderful thing to have happened. Our next recognition, Director Brown will give to the Women's Choice Award.
Yes, thank you, Alice, very much. So Tahoe Forest Hospital is named one of America's 100 best hospitals for patient experience. And this came from this is the Women's Choice Award. It is America's trusted referral source for the best in healthcare. The award signifies that Tahoe Forest Hospital has been ranked within the top 100 hospitals of similar size based on numbers of beds, of which there were 4 categories. Tahoe Forest was actually ranked number 32 out of 1,057 hospitals in the small size category. Our great medical and hospital staff at Tahoe Forest Hospital continually strives to provide a great experience for our patients and their families throughout their entire journey of healthcare with us, said Harry Weiss, President and CEO, Tahoe Forest Health Systems. This award is a testament to our staff's excellence and dedication to a patient-centered care, and we thank our community for continuing to entrust their healthcare in the hands of our great team. Tahoe Forest is one of a total of 400 award recipients representing the hospitals that have met the highest standards for patient experience in the U.S. by the Women's Choice Award. So congratulations to everyone.
Yes, and a round of applause for our Women's Center for their 2021 Women's Choice Award. And then our last acknowledgement is our Employee of the Month, and Ted Owens is going to be doing that for us.
Chair Wong, directors, I am stepping in for Alex, who was drawn away from the meeting this evening. So it gives me great honor and great pleasure to announce the Employee of the Month for July. And that is Sarah Wojcik, staff nurse, ER, Incline Village Community Hospital. So let's give her a round of applause. And I'll read a little something. I saw Jake doing the jazz hands thing there. Excellent. Sarah is with us. Welcome, Sarah. I would like to tell you a little bit about Sarah. She's been with Tahoe Forest Health System since February 24th of 2020. And here are some of the things that her colleagues have to say about her. Sarah is incredible, intelligent, and represents the future of healthcare. She brings to the table a level of excellence and competence that is rare. And Sarah demonstrates our system's values and goes above and beyond in customer service. And she has gone above and beyond, putting in long hours and always being here to help all of us. Let's give Sarah another round of applause. Sarah, congratulations.
Thank you, Sarah.
And before before we maybe you ask Sarah if she would like to say a word or two, I would also like to acknowledge our terrific nominees for this month: Denise Strassner, Samantha Valoy, Joshua Fetbrandt, and Kimberly Osborne. Excellent group of folks. And back to you, Chair Wong.
Yes. And then Sarah, would you like to say anything?
I'll just say that I'm extremely grateful for the recognition. It's been a true honor working with the team here, and I'm accepting this on behalf of everybody that helped me with all of our endeavors here at Incline. It's been a group of misfits, I'll call us, getting the COVID vaccine to the community, and just very proud of everything we did as a team. So thank you very much.
Thank you, Sarah, and thanks to everybody. I know it's been a stressful time and that it's been a long 20 months with COVID. And to be able to say that you work as a team is just really heartfelt from all of our board. So thank you again for that work, and please thank your colleagues as well.
Director Wong, could I just comment?
Sure.
Since I had the honor of working with Sarah for the board, so they understand when the vaccine became active at Incline, she jumped in and made a significant difference in managing the process, the timing, how vaccines were given. She worked day after day. And thank you, Sarah, for all of your work that you did. It made such a difference.
Thanks, Judy.
Good job. Good job.
Okay. Item 13, we have the Medical Executive Committee meeting consent agenda, and Dr. Jonathan Lane will be presenting that.
Thank you. Dorothy, can you put up the,
Hi, yeah, Martina, am I able to share the screen? Oh, here we go. Yes, I'm able to share now. There we go.
So MEC approved what the surgery committee had already okayed, and it was giving additional privileges to ophthalmology for outpatient. So they were already doing this as inpatient. Now they've clarified and are including more outpatient procedures, and these will be done, I believe, in Incline, and they can be done in Truckee. And we're having a new ophthalmologist, Dr. Conway, is joining Tahoe Forest. And so they've just clarified the procedures that are okay to do on an outpatient basis. Do you want me, I'm not sure people need us to go through each one individually, and none of this is all very standard for ophthalmology to be doing.
So Dr. Lane, Dr. Conway will have privileges to do outpatient surgeries, both in Incline and in Truckee.
Yes.
Okay.
And so some of these are actual surgeries. Some of these are things that can be done in the clinic, taking out sutures, for instance. Not all of it's going to be in a surgical setting, but just in an outpatient setting. Okay.
Does our board have any questions about the ophthalmology policy and the procedure list?
No.
Okay.
If there are no questions, does our audience have any questions in regards to ophthalmology? Okay, seeing or hearing nothing. Can I have a motion to accept the Medical Executive Committee meeting consent agenda regarding the new policy for ophthalmology?
So moved. This is Mary.
Okay, so it's been moved. Can I have a second?
I'll second. This is Art.
Okay, so it's been moved and second to approve the policies and the privilege card for ophthalmology. Could I have a roll call?
Director McGeary?
Aye.
Dr. Shamlin?
Aye.
Director King?
Aye.
Director Brown?
Aye.
Director Wong?
Aye. So Dr. Lane, your medical executive meeting consent agenda has been approved.
All right. Thanks so much.
And moving on to item 14, the consent calendar. These are generally reports. They're non-controversial documents and reports, but can be pulled for any reason by a member of the board or the audience. So is there anything that anybody wants to pull from our consent calendar? So none of our board wants to. Anybody from our audience? Then can I have a motion to accept the consent calendar as presented?
So moved, Dale.
A second, please.
I'll second, Michael.
Okay, but it's moved by Director Shamlin, seconded by Director McGarry, that we accept the consent calendar as presented.
Director McGarry,
Aye.
Director Shamblin,
Aye.
Director King,
Aye.
Director Brown,
Aye.
Director Wong.
Aye. So the consent calendar is approved as presented. Moving on to number 15, items for board discussion. We have some friendly faces from the library to do an update of what's happening with our local library. We've got Louise Zabriskie and Kathleen Egan, and I think the friends of the library are all around.
Thank you, Alice. Kath and I are delighted to be here tonight. Am I able to screen share for our presentation?
Martina?
Yes, you're all set, Louise.
I'm all set?
Yes.
Okay, but just as happens sometimes, I have to now re-find my, just 1 minute.
We're not going anywhere.
Yeah, I know, thank you. Okay, here we go. Okay, am I up on the screen share yet?
Not yet.
Not yet, okay. Let's try it one more time then. Now are we up?
Yes.
Good, thank you. Okay. So I am Louise Zabriskie. I'm president of the Friends of the Truckee Library, and with me is fellow board member Kathleen Egan. And thank you so much for the opportunity to tell you about our community's vision for a new library facility.
Our objective this evening is to give you a brief look at the Library Up Community Outreach Initiative that we've been conducting over the last 10 months. And this is so you, as elected officials, have a firsthand look at the message behind the vision of this new facility and what people are talking about. We're excited about this project and we hope you will be as well.
Okay, let's get back to present.
So we've grown a lot since our population of 2000 in 1975, yet our library has not. It doesn't begin to have the space to meet our need for services and programming. Modern libraries build community, properly sized. They facilitate human connection, which is known to be essential to the health and well-being of us all. So what are other small towns doing?
First, Steamboat Springs, a mountain tourist community like Truckee, with a population just under 14,000, has a 35,000 square foot library. It is a warm, welcoming, and interactive building. It's kind of like an extended living room, a place somewhere in between school, home, and work. The library has become one of the premier assets in this town. On the average, more than 1,000 people use this library every day.
3 years ago, Half Moon Bay built a 22,000 square foot library. City officials described this library as transformative in the community. It has become the place where everyone goes, whether it's for meetings, job interviews, or just to hang out between soccer games.
Building a connected community requires space, the right space, inspiring space, comfortable space, and definitely flexible space. It is a warm, oh, I'm sorry. There are a few places in our community, other than private homes, bars, or restaurants, where people can meet. Modern libraries have spaces that enable people to act independently, collaborate, or create connections at no cost. Libraries help build the very social fabric of the community by providing places for people of all ages and walks of life to meet in groups, large and small. We understand there are numerous studies highlighting the importance of social infrastructure, like libraries, as a protective factor against loneliness, isolation, and the attendant health risks. The most successful modern libraries have space for programming that is at the very core of creating an active community hub.
Our chamber refers to growing our own as providing opportunities for locals to live, work, and thrive in their hometown. Libraries are a place for people to seek employment resources and support. Some of our special districts see this new library as an ideal central location for job promotion, with adequate space for job training programs and certification classes. In a conversation with Harry Weiss and Judy Newland some months ago, they also saw value in having a curated collection of reliable health-related resources for people to access.
Children need an exciting, engaging place for the array of programs offered by our library with enough space for our growing community. Our teens need a free, welcoming place to study, connect, and collaborate on projects after school, or maybe just a place to hang out with friends.
Libraries are the civic institution designed to serve every age, income, ethnicity, or physical ability, and it's free. As the disparity in our community continues to grow, the library is a place where we all are welcome, no matter our circumstances. Library programming looks to serve the needs of every segment of our society. Libraries also partner with social services and other agencies and providers to help meet those needs. I have to say the overarching theme with this initiative is we are working together as a community to bring this new library to reality. Through a vital partnership with our Recreation and Park District, a 2-acre site at Regional Park has been set aside for our new 20,000 square foot library. Together, the town, Rec and Park, Sanitary District, and PUD are working out the details of how to best approach land ownership intricacies on the site. I gotta say, I'm always amazed at how our various agencies are willing to come together to achieve great outcomes.
While many are involved, the primary collaborators to date on this effort are the Friends, Nevada County, and the town. Placer County has been involved in some of our discussions, and although in the very early stages, we are beginning to see their interest in exploring the possibility of a regional approach to the delivery of library services.
Starting last fall, the collaborators jointly selected an architect, and we met weekly to develop a conceptual building design, initial cost estimate, and renderings of a new facility. This has been a crucial step in bringing the vision to reality. This fly-through video helps us imagine what this new space could look like, but more importantly, what it could feel like.
The independent cost estimator has pegged the total cost at just under $25 million. Construction funding is expected to come from a variety of sources. The Friends is working with the county and the town to develop the governance and financing structure for the new facility. Once built, the county will continue to fund operations.
So this endeavor is a multi-year initiative, and these are the major steps. The Friends has developed and is implementing, as you see, a regional education and awareness program. And the county, town, and Friends have just completed the conceptual plans. We are now jointly seeking proposals from consultants to help us fully explore a joint powers authority as the likely financing and governing vehicle. We see a number of joint library JPAs throughout the state.
Once that has taken shape, we will select the primary architect and bring the design to completion, including all the attendant studies and town approvals. These are the startup development tasks. Then will come the capital campaign and likely a bond measure. If all goes well, we could see the new facility open in 2026. It'll be here in no time.
We want you to know that community support is growing for this new library, as evidenced by our Luminaries program. This initiative is distinct from a full-blown capital campaign, as it is designed to help seed fund startup development costs.
To date, over 150 individuals, families, or businesses have shown their commitment by donating $1,000 to become a Library Up luminary or $2,500 to become a business luminary. Our luminary initiative dramatically demonstrates to elected officials, large donors and grantors that this community is serious about, invested in, and committed to building a new library in Truckee.
As you know, our community has an amazing track record for making great things happen. The Legacy Trail, the Rec Center, the Humane Society, and the Cancer Center, to name just a few. Together, we can build a library that will be a true cultural center, adding it to Truckee's list of remarkable successes. It's time for us to dream big and ensure that our library is a true reflection of our diverse and amazing region.
Thank you so much for including us on your agenda today. We do appreciate your interest in the Library Up initiative and our collective efforts to bring this much needed spacious civic institution to our community. And we're happy now to respond to any questions you might have.
Well, thank you, Kathleen and Louise, for just a great presentation. I'd like to ask more about, I'm glad, number one, that we're moving, because the current library is so dark and so old.
Yes, it is.
That it will be nice to have natural light in. My question is, as you talk about expanding the library, what are we looking at in terms of who's certified and who's a librarian, and do we attract those kind of people? How many do we need? I mean, it just seems that there are so many other obstacles to kind of get through to get this library going.
Well, would you like to respond, Louise? You would like me to respond?
Go ahead. I'll jump in if necessary.
You know, the Friends of the Truckee Library aren't running the library. So, but everyone who is currently on staff with the Nevada County Library System really has the qualifications and the certifications that you're talking about. I think we probably could do a lot more with volunteers. When we look at other libraries throughout the state, there's a lot that's done with the volunteers at the Half Moon Bay Library and Steamboat Springs as well. The county has estimated increases in staff and has it in the budget. It has gone out, you know, I don't know, I guess a total of probably 18 years. And they have built in there staff increases in order to accommodate the increase in size. So, you know, that's their job to identify operations, and they feel comfortable that they're going to be able to do that. I don't know if that answers your question.
Yeah, it does. Yeah, that they have to, the county is going to be looking at that versus we have to find all of that.
That's right. That's right.
And I just was going to comment that we have this incredible librarian today, Bobby Luster, who is our branch librarian for Truckee. Her husband has a business here. She's moved here the last few years, and she's a community member, which is very fortunate given the challenges of today of people coming into work here. So
sure.
Yeah, this is Art. I've got a quick question. You said the funding would be a combination of capital funding and a bond measure. Do you know what that allocation, I mean, what are you shooting for there?
Art, that's going to be one of the things we look at when we're working with the consultants in the JPA. You know, we certainly, it's the Friends of Truckee Libraries who are going to be the ones who are working on the capital campaign, and we'll tell you, and we've said it to the county over a year ago and the town, that we certainly can do $5 million. And we feel that with the right set of circumstances, we would be able to get up to $10 million with that.
Okay.
As you all know, especially with your Measure C, you know, you really need to check the appetite of the community in order to determine what you are able to do with a bond measure. So that will be part of the mix. We're fully expecting that maybe within a year, we will go through that survey process to identify what that appetite would be. And then that would be supplemented, of course, with, you know, we're expecting certainly funds from the county and frankly, hoping for funds from the town as well.
Okay, thank you.
Kathleen, Dale Chamberlain here. I live in Tahoe Vista on the other side of the hill, Placer County. And I'm just curious, you mentioned something about a regional approach, and I'm just curious how that would flesh out.
When we first started, I was looking at Louise to see if she wanted to respond as well, although I guess you directed the question to me, Dale, which is fine. Hi, Dale, how are you?
Good.
Back when we first started, I would say, wouldn't you say August of 2019, Louise, probably around then, we reached out to the Kings Beach Friends of the Library and said, we want you to know that we're looking at a library here in Truckee. We just want you to know about it and really listen to what you feel positively or whether you may have some concerns about that. And they actually felt very positive about it at that time because they felt we've coined the term, it could be a mothership for the area because there are difficulties in delivering services both at the Tahoe City, as we understand it, at the Tahoe City Library and the Kings Beach Library because of limited staff. If somebody's out sick or if they have to go to a seminar, let's say down in Auburn, the library's closed. And so therefore we're not delivering services. And that launched a conversation with Cindy Gustafson about, you know, we want you to know what's going on here in Truckee. And, you know, maybe there's a way we can work regionally. In fact, on August 2nd, we're going to be meeting with Cindy. Cindy is calling a meeting with the Friends of the Kings Beach Library and the Friends of the Tahoe City Library to talk about what might be the possibilities under a regional approach to delivering services up here. And with the partnership, I think what's being envisioned between Placer and Nevada counties.
Okay, thank you.
And I just would like to point out that it was one of the things we feel very strongly about is we in no way wanted to affect adversely the Kings Beach Library or the Tahoe City Library, because particularly the Kings Beach Library, my understanding, is so integral to the importance and the core of that community. But clearly they don't have the space. And if we have larger community rooms for programming, we're on a TART stop, where they looked at it as when we were talking to the friends and the groups there, as a very exciting possibility to have, like Madeline Helling is on the west side, Truckee might possibly be on the east side. So that, and many of our community members live in Placer County. So,
yeah,
which is even more of a, yeah.
Gotcha.
Any other questions from our board for Kathleen or for Louise? How about from our audience? Any questions?
Mary Brown has one.
Yeah, just unmuted. I've got a barking dog over here. I wanted to make a comment and commend you both for what you're doing and taking on this project. You and I have spoken before, you both and I, and I was involved in a library foundation in the inner city in the East Bay, and you know, it was just the most wonderful safety net institution.
Yes.
That I think the community had. The needs that the library filled were as varied as the people who use the library. And to those who say, you know, libraries aren't really relevant anymore, I would just point to some of the programming that we had going on with the after-school programs, the adult literacy, those kinds of things. They don't have a shelf life, and they go on and on. So thank you both very much.
Thank you. Well spoken.
Okay. Well, thank you, ladies, both for your presentation. We wish you the best and look forward to hearing some updates on how the progress is being made on the new library.
Thanks
Thank
to
you,
you all
Alice.
very much for
Yeah.
allowing us to be here tonight.
Thank you.
We'll move on to item 16, and these are for board action. We have 16.1 Measure T support, and we have Bill Celine, our Truckee Fire Chief, speaking. So Bill, if you're there.
Is there?
Hey, Bill, thank you for coming.
Hey, thanks for having me. Good evening, Madam Chair, directors. Yeah, I appreciate it. Of course, a lot going on fires in the news and around us. Unfortunately, a little bit too close to home. Of course, I know a lot of you, but my name is Bill Celine. I'm the fire chief for the Truckee Fire Protection District, and we're a bi-county district, and we cover about 125 square miles. And of course, Truckee is the most populous part of our district and at the center. I have a short presentation tonight on fire prevention, and I want to end with something we can do about it, which is Measure T. I'm also joined by Gerald Herrick. He's a fire board director. He's representing Measure T campaign committee and sitting next to me here. So I'll share my computer when I'm ready for that. And if you're okay, I'm gonna see if I can pop up my screen. Martina. I'll move pretty quickly. This is a savvy group of residents. You see my screen okay?
Yes.
Yes.
Okay, let's see. Thanks. Appreciate your patience. I know many of you have heard the background on why the state and the entire Western United States, the wildfire conditions are worse than ever before. But, I just wanted to make a point on the front end of this, that Truckee is no exception to this 100 years of fire suppression and fire fuel buildup and people moving to the wildland urban interface. And then now, of course, climate change, which is really happening in front of us right now. It's combining to create this potentially disastrous condition. Take a look at this map, if you will. This map on this slide shows this 100-year fire history of the Truckee area. We all often talk about the 100-year fire history, and I think, we sometimes think it's happening somewhere else, but it is here as well. If you look at the bottom of the picture, you'll see the red circle, and of course, that's sort of the Truckee Donner Summit areas, and you can see Donner Lake kind of at the middle of that. You don't need to pick out much more detail than that. I have two takeaways from this picture I wanted to point out. First, most of Truckee and the resident, by the way, the yellow is the fires, right? Those are the big fires that have happened in the last 100 years on this picture. So if you look at the bottom of the picture in the Truckee area, you'll notice that most of Truckee and the residential areas have not seen fire in the last 100 years. Which really tells us that, our neighborhoods, our areas around our neighborhoods, the WUI, the wildland urban interface, has got this buildup of trees, branches, pine needles, other fire fuels that make fire more intense and more difficult to control when it does start. And I think, all you have to do is turn on the news and see the Beckworth or the Tamarack fire, and you can see that sort of playing out in 3D. The other takeaway is that our local forests and our climate is not immune from big fires. And you can see that by these yellow areas, which show some of these big fires. Some of you may have been here in 1994 for the Cottonwood fire that you can see up on the top of the screen. And then just below that, of course, the Donner Ridge fire in 1960, before all of our times, right? Some of these big fires, have happened, in the last 50 years. And so even since then, we've seen a lot of growth back in those areas. You're probably well aware by now we're in this extreme drought and moving towards exceptional drought. The colors are getting darker on the screen day by day. You know, what does that mean to us and to the fire conditions? Well, I think it's probably obvious, you know, it causes those fuels that burn, like the bushes and the trees, to dry out sooner. It creates a longer fire season like we're seeing this year. It really started in May. We have some really big fires going right now, which is unusual for our area to see fires of that magnitude right now. You know, we expect that sort of in the later fire season, October, November time. Of course, drought creates stress on the trees. It allows the bark beetle to take hold and it makes them more prone to fire. It also makes them more prone to tree death, which of course in the southern and central Sierra, we've seen a lot of that. And so this overcrowded forest has got a lot of problems related to that, and the drought exacerbates it. As I mentioned, CAL FIRE's reporting we're about 4 to 8 weeks ahead of typical year on fuel dryness and fire activity. It's you know, no end in sight. Of course, the drought's affecting for us the anticipated fire conditions throughout the West, and you can just imagine what the red means. You know, the red means that we're in this sort of above normal potential for a significant wildfire. And this particular picture is of August, but September and October, November, frankly, don't look any different than that. This is based on, you know, anticipated weather patterns and fuel dryness and those sort of things. They look ahead and try to predict some of these. You know, I'd like to tell you this is sort of unique for this year, that this is, you know, because of the drought and this sort of perfect storm that we're seeing. But really over the last 20 years, we see this map with these red splotches all around us and in our area more times than not in the last 20 years. So we're reaching that point of sort of perfect storm. You know, some of you have been around here for a while may remember the similar drought year to this year, 2007. And if you look across the top there, I just threw a couple pictures in here to make the point. There's 3 pictures that show these significant fires we had that year. The Angora fire at South Lake Tahoe, you probably remember, it was probably the most notable one around here. It started from an escape camp fire, of course, something that we're concerned with here in our neighborhood. And it burned down 250 homes in the afternoon in a neighborhood that doesn't look much different than those in Truckee. And that's what struck me when I drove through that area. The other pictures that I put on there, you know, make the point that, you know, our Truckee fire crews have years of experience fighting fires in the Northern Sierra and throughout the state for that matter, and the mutual aid system. You know, they're reporting back these mega fires are getting more prevalent, that the fire intensity is dramatic, and the fires are really difficult to control. You know, they're having to back up and make their lines longer and further away from the fire. They're also getting closer to our area, and I probably don't have to tell you that. But of course, Paradise Fire was a few years ago in 2018. But last year, the record-breaking North Fire, which in the Quincy area, maybe you've been up there and you've seen the burned forest up there. And then the Creek Fire, Shaver Lake. I know some people from this area go down and camp there. And those areas have sort of similar climates to Truckee. You know, similar type forests. Each of those fires to over 300,000 acres. To put that in perspective, the Truckee Donner Summit area may be about 50,000 acres. And so, you know, the Beckworth fire that's burning right now north of us is about 2 times when you overlay that map over Truckee, which is sobering in itself. So, you know, these nearby fires, I mean, not meant to scare us, but I think they need to remind us that we can't be complacent with fuels and emergency management efforts, that, you know, we need to continue to push forward with the fire prevention side of things. And so that's really, you know, what I want to focus on is, you know, what can we do about it and what are we doing about it? And, you know, we sort of think about it in 3 buckets or 3 legs of the stool, if you will. Reducing fire fuels is the gold standard, both on larger pieces of land and in and around our neighborhoods. Of course, reducing the number of fire starts is important. And so things like the burn ban, and, you know, we look at trends and try to insert ourselves where we can. But I think, you know, fires are going to happen. Wildfire prevention works, of course, when everybody participates. There's a certain amount of personal responsibility we have when we live in Truckee, for example. by reducing our fuels around our house and creating that defensible space that we talk about. And then of course, heating evacuation notices. Of course, a solid emergency response system is important to keep fires small. I think, I'm happy to say that we're in an area with a really robust local fire response with the Forest Service and CAL FIRE and a significant sort of deep local agency mutual aid system. I'm not going to talk a lot about that tonight, but that is good news here for sure. Unfortunately, there's not one thing that can be done by itself. There's not an easy win here. I wish I could tell you that all we have to do is this and it'll be all better. It's ongoing work in all three of these buckets. But with that said, it's sort of a sobering first part of the presentation. I sure don't want anybody to feel discouraged. I think we want to be proactive. There are things that we can do. So, I've used the term WUI, wildland urban interface, and I know those of you that have been around are really familiar with that. But I just wanted to throw this picture up because this is sort of the picture of the WUI. This is the Truckee area, and you can see where our homes and our neighborhoods are, and you can see those by the dark spots. And then you can see we sort of bubble these circles around those areas. Those are the areas where the fire district focuses efforts on things like fuel reduction and fire prevention. We care about the whole forest, but I just want to be clear that, where we want to make a difference to protect our homes and neighborhoods, we have to focus sort of in the bubbles, in the WUI area. So what do we do in those areas? Well, here's one type of work that takes place in the WUI. This is this larger pieces of land. There's larger pieces of land. They're owned by agencies, public agencies. They're owned by private individuals. And they're all different shapes and sizes, but they're in and around our community. And all you have to do is drive down the street and you see that. Unfortunately, these lands, and I'm sure it's not unfamiliar to you that go hiking out in the woods, you see this, it's overgrown, it's unnaturally dense. Because of this 100 years of fire suppression. People moved to the WUI, we had to suppress the fires, and we've done a good job at that, but there's unintended consequences for that. The dense forest, of course, is sometimes aesthetically pleasing, but as I think you probably know, it's not natural, and it causes the vegetation to compete for limited resources. And this year, of course, it's water, and that's gonna have its own sort of problem in itself. The answer, of course, is to return the forest to this more natural conditions. And we do that by first mechanically thinning and cleaning up the fire fuels. Here's an example of a 1,000-acre project that's grant funded. It's going on right now. It's just finishing up, actually. And it stretches from Glenshire to Brockway. And it's the trees have been reduced in that area and thinned out, and all the dead material that's built up over all these years has been pulled out of there. And you can see sort of the picture on the right-hand side. And if you've hiked out east of the airport or in the Waddell area, you've seen some of these lands like that. And of course, fires will still happen and they'll still run through this, but it'll be much lower intensity. Fire crews will be able to stop the fire more easily, and we'll be able to maintain that. That'll be a lot less costly over time to maintain that. So, you have maybe seen this picture before, but I think it's one of the best examples of fuel reduction work working in Truckee. And it happens routinely on fires, but this is one that I have a picture of that I thought you would be interested to see. This was in 2007 during that drought year. It was the I-80 fire. It was burning up from Donner Lake, and it was heading towards Tahoe Donner. And it was roaring up the hill. And you can see the flame lengths that the airplane took here. But if you look closely at the area in front of the fire, you can see where the large brush had been cut and removed in a fuel reduction project that Tahoe Donner and Bill Howdy Shell had been leading for many years up there. When the fire hit this area, the fire crews were on the ready, and they knew that they were going to get an opportunity when the fire slowed down to jump on the fire and put it out at that moment. And so they amassed resources. The fire hit that area, and they were able to take it down and quickly knock it down before it reached the top of the hill. And it saved homes in Tahoe Donner, frankly. And if that wasn't there, this would have been a much different story for our community and for the Tahoe Donner area. And we see it play out in California all the time, unfortunately, more frequently recently. So we need to do more of this work, frankly. We have thousands of acres of land, and we have cooperative landowners that want to do more work. But, just to cut to the chase, they can't afford it. It's very expensive to do it. It's $2,000 to $3,000 an acre. And, you know, we sort of have waited for years and asked people like, please do the work. And some do, lots of people do the work, but some don't, and some can't afford it. And so we can continue to wait, or we can take action. And that's sort of our objective. Of course, let me take the second bucket, you know, the second sort of big bucket, and I'm not going to go into detail on this because I think you're all savvy on defensible space. And of course, this is really important to protect our homes and neighborhoods. It's reducing these fire fuels around your home. The biggest barrier of getting rid is getting rid of that green waste, that defensible space waste. You know, people cut down branches, they do a good job of removing bushes. We have nice little containers that the town has provided us, you know, for pine needles and that sort of thing. But it doesn't really manage the defensible space material that we see produced. And it's costly. If you don't have a truck, you don't have a trailer, you have to hire somebody. At the end of the day, what happens is it's enough of a barrier that people don't get work done. So we need an easier and less expensive way for people to dispose of this defensible space. And we've seen communities that have done that and it's been successful. And so we need to take it to the next level. All right, so here's my last slide. And that's sort of the background that builds to this. There's a lot of things going on to prevent wildfires. There's a lot on the fire response side of things. But frankly, we know we can do more. And we want to be proactive, and we want to take wildfire prevention to the next level. So to that end, the fire district facilitated this process. It was called a Community Wildfire Protection Plan. We refer to it internally as a CWPP, and it was 5 years ago, and it has a sort of a systematic process and a plan that's been developed and standardized throughout the United States. We used input from community land managers and HOAs and community members. We identified at the end of the process a whole bunch of acres that needed fuel reduction work. We mapped those, we put them in a list, and they're in the plan. You can actually see that on our website. But I'll tell you, come forward 5 years, and a lot of people did a lot of good work, a lot of agencies did work, but there are thousands of acres that haven't been able to get completed, and the cost is the biggest barrier. So, you know, I'm just here to tell you that we're just not at the pace and scale that we need to be at to make a significant impact. But I think there's an opportunity right now to get there. The state says that this fire fuel problem in the state of California is a $2 to $3 billion a year problem. But the funding doesn't come close to matching that need. And of course, some of you maybe heard the governor say, you know, we're going to put $1 billion towards fuel reduction and wildfire prevention. When we got down through the details of that, it's really more like $100 million, and it's very competitive with Southern California and the Bay Area and big communities. And so, you know, we've been lucky. We've worked hard. We've got $3 million of grants in the last 5 years, but it's just not enough. Like it doesn't make a significant impact, and this stuff grows back, right? It's not like building a building, unfortunately. So it's not a consistent funding source to you know, hedge our bet on grants. So with that in mind, back in January, the Truckee Fire Board, they surveyed voters, and they learned a couple of really important things. One is 95% of voters said that wildfire was their #1 concern. I don't think that's probably a shocker to anybody on here. The second thing, though, is that they found out that 79% of those voters in that survey said that they would gladly pay $179 property tax, annual property tax, to build a what we're referring to as a community wildfire prevention fund. It would raise about $3.7 million annually, and it would go for 8 years until it reached its sunset. So fast forward, this measure is going to the voters in a September. It's a special election, so the funds are very tightly controlled by the ballot language and the resolution that the board approved, and it's all focused on wildfire prevention and fuels removal. It has no money for firefighters or fire engines or fire stations or any of that stuff. It has a citizens oversight committee attached to it as well to make sure that you know, we do what we're going to say that we say we're going to do in there. The money would be spent on things like environmentally sensitive fuel reduction. You know, this isn't clear cutting kind of work. This is forestry work that's overseen by registered professional foresters and that sort of thing. Easy, green, and defensible space waste disposal, improved evacuation systems. You know, it's just to name a few of the things that are highlighted in there. So, of course, you can read more details at truckyfire.org. There's of course, a separate local campaign committee that can be reached as well at yesont.vote. In closing, I wanted to mention, because people have asked this question frequently, is what about insurance? How does insurance tie into this? And I just wanted to let you know that I spoke to the state insurance commissioner, Laura, 2 weeks ago, and he said that simply, reducing risk is the answer to reducing our insurance rates, which, is not a surprise, but his department and he are focused on working hard to make sure that the insurance underwriters look at the real risk, which is, how much fuel's around your home, how much defensible space work can be done, rather than looking at satellite imagery and things like that. And so the state and their agency is very sort of focused on getting that. Now, there's no direct line, like I can't tell you that this is going to reduce your insurance rates, but I think it is what we can do, right? We can reduce risk, and we can make it sort of objective and measurable so that people can see that, like underwriters that are, have our insurance in their pocket, and they cancel it routinely, which makes things, of course, challenging for all of us. So anyway, I'm going to stop sharing, and I'm going to just hand it over to Gerald just for a second here. And then I can answer any questions as well.
Hello, board members. Gerald Herrick, 9-year board member with Truckee Fire District. I was on the Measure C Oversight Committee for 5 or 6 years. I can't remember how many years. Thank you for letting Bella and I talk to you a little bit. And I'm going to speak to you for 3 minutes. So I'll be very quick. Our board has taken this seriously in terms of approving this decision to go to the voters and ask for money. We take that seriously anytime we ask our residents to give us their money. But we consider this to be a very important matter. And in some ways, we're a little frustrated that we hadn't gone to the voters earlier and asked for this money. We're worried about fire prevention in the coming months and the next several years. So my job is to ask you for your endorsement for this, for our Measure T. Chief Saline can't do that. It's a violation of state laws for him to be in official capacity and ask for support for something like this. He's the fact guy. So again, my job is to ask for your endorsement and any other supports you might be able to provide, whether it's as the hospital district board, administration, or as citizens of the fire district. I also know that several of you don't live in the fire district, but the hospital district does cover both Nevada and Placer County on the east side. So Bill and I are available to ask any questions you might have. And thank you for letting us talk to you.
Thank you so much for your presentation. Does our board have any questions for either Chief Saline or Gerald?
Yeah,
Director King?
Yeah, I've got a question. So $179 tax can be a lot to a homeowner, but 3.7 million doesn't sound like a lot. Can you do a lot with 3.7 million?
Yeah, we think
that's annual. So
yeah, we think we can do quite a bit. And right now we've won $3 million over the last 5 years, and we've done some significant fuel reduction projects and in and around Truckee and some fire breaks. And we think the combination of getting rid of more green waste, that bigger fuel from defensible space work in the community, as well as doing more of those larger projects, and maybe in the ultimately we'll get another 3,000 to 5,000 to 7,000 acres done over the next 8 years. And then as well as a real good consistent program of being able to remove fuels from people's curbside, that those two things alone will generate maybe up to 10,000 tons of material more, which would be sort of a third more than the entire region produces right now in biomass. And that's a lot of fuel out of the environment. And so we do think we can make a pretty good impact with that. Of course, we hope it's not a bottomless pit, right? We want to be reasonable and do things that are impactful. But of course, we want to make it manageable as well. And we could ask for more money and it could get to the point where it'd be difficult to manage. So we thought this was sort of good in between ground too, Art.
Okay, thank you.
Dale? Dale, you're on mute.
Well, I've got a question for you, if I may. I was in the 1991 Berkeley Oakland Hills fire and watched that devastation up close and personal. Counted a dozen friends who lost their homes. And of course, it's devastating to lose a home, but the possibility of losing the hospital would be really doubly devastating to this community. I know we occasionally do a survey of the fire safety for the hospital, but we have been expanding outward slightly in recent years, and I'm just wondering if you are aware of our efforts to make sure that the hospital itself is safe.
Yeah, absolutely. Obviously, critical infrastructure, even in Measure T, is a priority. Fuels work and fire safety efforts around critical infrastructure is always has been and will be a priority, and will be able to be funded in a program like this. We work in the fire marshal, Kevin McKechnie, work closely with your risk management and safety staff, and we review plans routinely. We do fire inspections, and we feel like we're very engaged in those matters.
Good.
And just with the functioning of the hospital, I mean, if there's fires in the area, we are the only facility. And just in terms of trying to treat people, it becomes unwieldy. So to be able to do some of this fire prevention and reduction would be very helpful.
Yeah, we agree. I mean, I think just sort of high level, we would rather not evacuate the hospital or shut down the hospital in the wildland fire. We'd rather shelter in place and have you continue operations and continue service to emergency needs and things like that are going on. And we can only do that right with robust sort of fuel management efforts.
Crystal, you had a comment?
Yeah, I had a quick question. A lot of homeowners are struggling maintaining homeowners insurance because of fires. And I was wondering if these efforts will help our local homeowners be able to either possibly reduce their insurance premiums or even obtain insurance again. And I didn't know if you've looked at that angle.
Yeah, absolutely. And that's an important component of this. To the end that, we spoke to State Insurance Commissioner Laura about that. And we are in alignment with the State Insurance Commissioner's efforts to try to get control of the insurance crisis. And there's a lot of sort of components of that. It goes back to underwriters and market-driven economics that are going on. But the answer in all the fronts with the underwriters and the insurance commissioner's office, from the best we can tell and the state fire agencies can tell, is the answer is reduce risk. And in wildfires, reducing risk is reducing fuel. And so that's where this centers around. And so although there's not a direct nexus, nobody has said if you do this, your rates are going to go down. Or we think that standing apart from the other 2 million homeowners that live in wildland urban interface and very high fire severity zones in California, we can separate ourselves and we can make our risk look less, and it's measurable and objective and people can see it. And that's what underwriters like. And that's what we believe will help them continue to write policies here, because it's a big market. We understand that they don't want to leave it. They want to stay in it. And they just need reasoning on why it makes sense for them and what differentiates us between other people that live in similar environments. So anyway, I don't want to be evasive, but that's, I think this is the single best thing that we can do for that.
Mary? You're on mute.
I keep blaming it on the barking dog. Thank you both for your presentations. And I must say that while you were presenting, I was a little bit distracted because I have 4 family members who are evacuating 3 homes in Lake Almanor and 1 in Greenville as you were speaking. So I'm a little emotional about this. But, and at one point in time, when I first saw this come onto the agenda, I thought, is this really our mission? And, as I listened to it and I listened to the other board members' responses, I'm like, absolutely. This is the health, the safety, and the welfare of our community. And I just think we absolutely have to endorse it. I have to say, thank you.
Do you have any comments from our audience? So Ted, want to turn your microphone on?
Certainly.
And do you want to lead us through the rest of this discussion?
Certainly. Before we do, I'd like to thank the chief for getting me up-to-date information about a fire that was starting not far from my home this afternoon. So this is a real thing, and I feel for you, Director Brown, and your family, and hope they are all safe. This evening, the decision before you is one of endorsement. Several other special districts have endorsed. The airport district of the town of Truckee. It's on the upcoming agendas of the Rec and Park and the TDPUD. It's also got the support, I understand, of Tahoe Donors HOA, the Lahontan Homeowners Association, as well as North Star. So this is for your discussion. Your choices are a motion would be a motion to endorse the measure, a motion to oppose the measure, or no action and remain neutral. And so the discussion should be along those lines among the board members. And in my summary, I did put some of the discussion points, one of which Director Brown addressed already, that of mission and appropriateness. I'll be here to answer any questions or guide you if you need it, but that should be your discussion.
Okay. Well, we thank both Garrick and Chief Celine for coming. And do you want to do this discussion as a board, or do you want them to adjourn the 2 speakers? How would you like to do this?
It is well, it's a public meeting. They can stay if they like. If they feel that they might be risking their quest by making you nervous, they might check out. But I think that would be their choice.
Okay.
Chair Wong.
Okay, so Director King.
Yeah, after listening to what we just heard and knowing what we know about the danger, I can't think of a single reason why we wouldn't support this. And my motion would be that we support Measure T.
Our responsibility as board members of the hospital is that the health and welfare of our community members, and I can't think of anything that's more important to the health and welfare of our community members than keeping them fire safe. And I can tell you from my experience with those who lost their homes, it not only were 23 people killed in that Oakland Berkeley Hills fire, but those who survived, their mental health went down the tubes when they were forced, oftentimes at older ages, to rebuild their lives. And so it's not just the physical health of individuals that we should be concerned about, but the mental health as well.
Okay, so Director King, you put a motion on the floor.
I did.
And the motion is to support Measure T.
Absolutely.
Mary?
I would second that motion.
Okay, so it's been moved and seconded that the Board of Directors of Tahoe Forest Hospital District will support Measure T. And Martina?
Director McGeary?
Aye.
Director Shamlin?
Aye.
Director King,
Aye.
Director Brown,
Aye.
Director Wong.
Aye. So the board will support Measure T, and you can put our name out there as you do your speaking. And I understand that the vote goes, it's on the ballot in September.
That's correct. It'll be on the governor recall ballot as the second item on their measure.
Get it.
Oh, what
Wonderful.
an interesting combination.
One quick question, if I may. Those of us who live on the lake side of Placer County will not benefit from this, will they?
Yeah, you'll benefit indirectly by reducing the chances of a mega fire in the Truckee area, and I'm sure you recreate and visit over here, so that'll be good. But yeah, directly no benefit and directly no cost. It's with fire district boundaries, which sort of a long and narrow fire district, and we bump up against North Star and Olympic Valley. It's the closest we get to you.
Gotcha. Okay.
I had a question. Will this require a 2/3 majority?
Yes, that's correct.
Thank you.
Well, thank you again, and we wish you the best with that election.
Thank you, Bill and Gerald, very much.
Bye, Gerald.
Yeah, thank you, guys.
Item 16.2 as a resolution, and Crystal will present information for our review on the GO bond property tax rate calculation.
So good evening. Ironically, Gerald, who happened to mention Measure C, is exactly what we're talking about here. Back in 2007, the taxpayers passed Measure C that generated $98.5 million for the hospital to be able to build the Western Addition, address some of our seismic issues, as well as the Cancer Center and some other projects. Every year since that measure is passed, we're required to provide to both counties, Placer and Nevada County, the rate per $100,000 of assessed value that we would like them to put on the property tax bills within our district boundary. Honestly, this is purely a math calculation. We look at our debt service requirement for the upcoming year. The counties provide us the assessed values. We go through and do the mathematical calculation and come up with the rate per 100,000 that we would need in order to cover the up and coming debt service payment. Where discretion comes into play is we provide that rate, and depending on what happens during the year, sometimes we will collect additional property tax revenues beyond what is needed to make the debt service payment. And that money sits in a specific reserve for future use and can only be used to service the debt on the general obligation bonds. So in several years past, this has been the point of discussion of how much reserves do we use? Do we use any? Do we use all of it, or somewhere in between? And I know Dale loves this topic, so he's like here on this one.
Yep.
So historically, when I've done this, I've tried to take an approach of utilizing as much reserves as I feel is appropriate, with remaining some in the reserving account in case the following year we don't collect enough property tax revenues to cover the debt service. So when we set the rate last year, my recommendation was about 85% of the reserve use, leaving about $100,000 left over just in case. I followed a similar methodology this year when I did the calculations, recommending we use 75% of the estimated reserves that we had left over after making the August 1st debt payment, leaving a little over $100,000 in reserves, and that would set the rate at $19.28 per 100,000 of assessed value. So if you have about a $500,000 home and that's the assessed value, it's going to be $19.28 times 5, or roughly about $100. When we first did the assessment of Measure C, property tax growth or assessed value growth was pretty dramatic in this region. And so we used an average 8% growth trend when we did that original analysis way back in 2006. Obviously, we've had a market crash, we've had an actual decline in assessed values, but we've had nothing but growth since the 12-13 year calculation. And for 21-22, based upon what the counties provided, assessed values went up 6.68%. So I tried to take a conservative approach to give you a recommendation of what I felt was appropriate, but obviously it is the director's discretion whether they want to use 100% of the reserve or none of the reserve or somewhere in between, which I've provided calculations on the tax rate summary, anywhere from a 25, 50, 75, 85, 100%. We had tried to provide the taxpayers an estimation of what we thought the maximum rate per 100,000 would be back in 2006. So we were asked to predict the future. Back then, we said the max would be about $18.76 per 100,000. My recommendation is $19.28 per 100,000. Over the years, we've also refunded and basically refinanced the bonds, never extending the time frame, but to reduce the debt service component, pushing on getting us down to that $18.76 per 100,000. I think we've done an excellent job over the years of refinancing the bonds without extending the time frame to be able to do that. So tonight before you is my recommendation, my recommended motion, the resolution, but obviously it is up for discussion for you board members to see if you like my recommendation or want to do something different.
Thank you, Crystal, for all the information that you did give us on the calculations. And again, what we're looking at is probably a 56% increase in the amount per 100,000. So let's open it up for discussion from our directors. Okay.
Come on, Dale.
Yeah, I figured those number people would have lots to say, but maybe you did such a great job at explaining it.
I'll start. I appreciate the information that Crystal sent. It's very clear, understandable. You know, there's no perfect answer. It's a judgment call. I like the idea of leaving something in there for reserve in case we need it next year. I doubt values will go down. I think they're going up. But nonetheless, you know, we need to be a little bit prudent there. So I was comfortable with the recommendation. Again, it could swing a little ways one way or the other, but I'm pretty comfortable with the recommendation.
Dale, do you want to give your numbers?
No, I'm going to go along with Crystal this time.
Whoa.
Somebody pick Crystal up off the floor. No, just kidding. Just kidding.
I know a losing battle when I see one.
I'm being quiet too. Yeah.
But again, it was a lot of really good information and history. So
yeah.
No surprises there.
Yeah.
And I think, you know, with everything else that's gone up in our economy, having this go up too won't be a big surprise to the public. I mean, their grocery bills are going up, their gasoline bills are going up, and so will their hospital taxes. Michael, do you have a comment?
I don't have a comment. I generally agree with what's on the suggested motion.
And how about our public? Any comments on the tax calculation or the recommendation? Okay, Crystal, you got it.
So the only comment I would have is thank you so much for your patience. I am dependent on the counties getting me the information, and it's always super close to this board meeting, and they need it by like the 2nd of August. So I have a very small window to work in. So thank you for taking the time to look at the material ahead of time, even though you only had it 2 days. So I just wanted to thank you for that.
Okay. Can I have a motion to set the 2021-22 fiscal year GO bond tax rate per 100,000 at $19.28, utilizing 75% of the reserves to fully cover the debt service requirements as suggested in the motion?
I'll make that motion. This is Art.
Okay. And I second, please.
I'll
I'll
second.
Go, Dale. It's yours.
Okay. Okay, it's been moved by Director King and seconded by Director Shamlin that we approve the motion that's written on our sheet regarding the GO bond and the rate of $19.28 per 100,000.
Director McGeary,
Aye.
Director Shamlin,
Aye.
Director King,
Aye.
Director Brown,
Aye.
Director Wong.
Aye. So the motion is approved and the tax rate is set then at $19.28 per 100,000. And Martina, you'll get that off of the cover sheet, the actual wording of the motion.
Yes.
Thank you.
And then, Martina, my only question is how quickly can we get signatures so I can get these to the counties?
And you need signatures from the
Chairman and treasurer?
whose
I believe
signatures
it's
are
the
needed.
chair and the clerk that are listed on
Okay.
the resolution. So Alice, if you're able to come by tomorrow morning, I will print it out before I leave tonight.
I will.
Okay.
And I'll just pick it up from Sarah to sign. All right, Crystal, thank you so much for all that work.
Yep.
We did not pull anything from the consent calendar. Do I have any board committee reports? I think governance met.
Yeah, this is Art on the governance committee. Just quickly, we had a really good meeting, covered a lot of issues. We discussed the board self-assessment tool. We're going to review the tool, and we've used the same one for the last couple of times, possibly shorten it, changing some of the questions. Pam Connect is going to help us with that, and it should be ready by October as we head into the self-assessment period. We reviewed the board education list for the rest of the year, felt that the topics were still appropriate, but this is always subject to change. We also took a look at the last 12 months of board agendas, just to see if there was any kind of a trend or something we could look at or something we could potentially change. Kind of the consensus we came up with is that the meeting length is fine. The regular meeting agenda items at the front of the meeting are fine. We did have a lot of COVID-19 reports last year. Hopefully we won't have any more going forward, and that took time. And we also asked the question, is there anything that we're missing that should be there? And we're going to try to get some input from Pam on that. So, and potentially, if we're looking to save a little time, maybe put more things in the consent agenda. But, it was a good discussion. Overall, we felt that the meetings were run well. They're not too long. And, we're really pleased with the way they were going. We had a little bit of discussion on the retreat follow-up, and we're going to have more on this issue in the fall. It looks like there will be a fall retreat. And again, Pam is going to help us with this. But the one comment that I saw in the retreat follow-up were a lot of comments regarding parts felt very rushed. And so as we create the agenda, or as you create the agenda going forward, maybe plan more accordingly to have the right number of items, and so we're not as rushed. And then we reviewed the 3 policies which were approved in the consent agenda tonight. So that's it. Next meeting is in October.
All right, thanks, Art. Any other committees that met?
I have a question of Art.
Sure.
Thank you, Art. Are we going to have the board self-assessment prior to the fall retreat?
I think what the plan was is to get something that the board could look at. Because again, if we're making changes to it, let's take a look at it and see if we all like it or if we have any other changes to it. So it's not, at least mine was, it wasn't just a committee decision.
But I meant the results of the assessment prior to as a topic for discussion.
Okay, what was that?
I was wondering if we would have the board self-assessment completed and the results available to us.
So Mary, right now we have the results from our 2020. We don't take the assessment until December.
Yeah, it should be
So-
done right at the end of the year. So it
Yeah.
wouldn't be done in time for the retreat in the fall.
Okay.
But we would, but again, we
ahead.
would have the new questions and the new assessment to look at, just to see if it seems appropriate, and then it would get used in November or December.
Okay, great. And my other question was around board education. I was hoping that we were going to have the Joy of Medicine presentation.
It was supposed to be this month,
Yeah.
but apparently Shawnee is not available, so it got pushed back till next month.
Okay, great. And a
Yeah,
comment.
I had the same question, so.
And I have a comment.
Oh, you
And
have a
that's-
comment?
We're going to miss you.
Yeah.
Oh, well,
Yeah.
You know,
thank
very
you.
much.
Thank you.
So go ahead, since someone brought it up, Art, and announce.
The surprise is over now. Anyway, as I mentioned in my letter, I've really enjoyed being on the board for the last 22 months. And I've learned so much. I've never been involved with the hospital before, so I've learned so much. And mostly that's because I'm surrounded by such smart people that work at this hospital. And people who really care about each other, people who care about the community. And it's such a positive and progressive business. It was such a joy to be a part of it. And I'm really proud and thankful to have worked with all of you over the last 22 months. It seemed like it went awfully fast. I mean, the one negative is that we only had 4 face-to-face meetings. Poor Michael's only had 1, I think. So I really did miss the interaction with each of you, but Irene and I are very excited about our next chapter in our lives and moving back to Santa Rosa. But I really, really thoroughly enjoyed all of my time on the board. So thank all of you.
And just to emphasize what Mary said, you will be sorely missed for sure, Art. You bring a lot of skills that we needed. You brought those numbers, you brought those questions. You weren't afraid to ask them. And I think that just encourages all of us to be more participative in our meetings. And your sense of humor, of course, will be missed. You and Dale going back and forth. So thank you again for your service and best wishes as you move on.
Yeah. So anyway, thank you.
If there's not.
Oh, I'll be in touch. Don't worry.
Yeah, good.
I want to see what you guys are up to.
Okay. Oh yeah, there's always streaming. I do want to say very quickly before we get on to any more committee meetings that by our bylaws, we are directed in terms of when there's a vacancy, what we need to do. And Ted's going to lead us through that process as we go forward. And Martina will be posting it. And again, we'll be seeing if there's letters of interest in becoming a board of director. Okay. And so you'll hear more about that and what part of the process we might get involved in.
Just to let you know, I am here till August 12th. So I do want to go through the governance committee minutes before I leave. Since we just had our meeting.
I'm sure that you can talk to Martina, who's taken those minutes.
Oh, I will. She does a great job.
Okay, well, maybe you won't have to stay and look at them then.
No, I want to look at them.
Okay. Any other committee reports?
Yeah, the Hospital Foundation board met. There's really only one update from the board, but a public shout out to Alicia Barr, who hosted our first in-person event in forever, and she hosted it at her restaurant, Drunken Monkey. So a special treat for all those board members. Upon closing the meeting, so it was primarily a social. I think most of or a lot of new board members hadn't even met. So it was mainly a social, but there was a vote and agreement to a funding goal of $1 million for the 3T MRI that's being put in over the next few years here. I unfortunately had to run to another meeting. Everyone got so carried away eating the good food that I had to run. Harry, was there any additional information as that meeting closed out to share?
I think that was really the wrap up. They were excited about the helping with the 3T MRI. And I shared with them that the number of months to raise it is not precisely important. They'll be successful. We know they will, and we appreciate it.
All right, that was it on that.
All right. Any other closing remarks? Well, if seeing or hearing none, then the meeting is adjourned.
All right.
Thank you.
Bye, everybody.
Thank you.
Bye,
Bye.
Art. Keep in touch.